I think so.
Recording. Okay, so this will be putting it all together, part three. We did growth hormone right at the end of the last session, but I'm going to just go back for that, just so we sort of
Okay.
get
Had a
it.
nice topic in okay.
Yeah, I mean,
Intriguing.
all of these are, we've covered these fairly extensively, but when we went over them, and
Yes.
in the future, if you're interested in doing peptides, they all stem from growth hormone in one fashion or another. So we'll go over that extensively. But
Okay.
so growth hormone is 191 amino acids linked together in a specific order and in a specific manner. I liken it to Legos. So that's what you see on the screen there. In the center, that's sort of the chemical composition of growth hormone. And the Legos, the one on the left is a windmill, the one on the right is a car. And let's pretend we went to the toy store and it's Christmas season and we bought a box of Legos with the car on the cover, and we're going to break pretend there's 191 pieces in there. And if you
Okay.
follow the instructions, what you get is you get the car. If you put it together. Now, if you have a 5-year-old or a 7-year-old with you, as soon as if you get to finish it, as soon as you get to finish it, he says, "Well, that's nice. Now let's," they pull it apart and do other things. So
Hmm.
peptides are pieces of growth hormone. Growth hormone stimulates growth and cell reproduction. And growth hormone is, quite essential for strength, energy, and sense of well-being in the adult. Before growth plates fuse, it's what tells our body to grow. So Judy was watching some crazy TV show last night, and it was about women that were large, and I don't mean by fat, I mean like 6'9". They were
Okay. Gotcha.
showing them skiing and riding go-karts and sort of just living, and they get one of them's going to dance lessons, and there was no guy in the dance class greater more than 5'10". That's
Goodness.
funny. So. Um, and the example the other example that's always given. Remember Andre the Giant? Remember him? Yeah.
Yeah.
So he had acromegaly. He had a tumor in the pituitary gland that caused his growth hormone to be accelerated.
Gotcha.
So for our purposes, the growth hormone has really two main functions. One is a lot like testosterone, so strength, energy, sense of well-being, muscle tone, um, uh, those kinds of uh, uh, characteristics.
Okay.
The other one, the big one that's always overlooked, and this is where you're going to shine because you're going to know about it, is what's known as executive function. The ability to get things done. Okay.
Hmm.
Executive function deals with memory, concentration, the ability to start projects easily or not, finish projects easily or not, multitasking easily or not, obsessive compulsive tendencies, and then sometimes dark moods and paranoias. That's usually a little bit more serious, but usually what we're going to see is those first few: memory, concentration, starting, finishing projects, multitasking, and particularly obsessive compulsive tendencies. You find somebody with that, you got to look at their growth hormone. Okay.
That it might be high.
No, low,
Oh, okay.
low, low.
If they're paranoid.
Yeah, also.
Okay.
Yeah, also.
Gotcha.
Okay. And you're going to see this in head injuries, especially, down the road, lingering,
Hmm.
so if somebody who's had a head injury, what you want to know is if they've had any personality changes. And that, you'll see a profound fatigue and depression in more than 80% of even mild traumatic brain injury patients if they've had some sort of either pituitary or hypothalamic disruption.
Okay.
Okay. So it's not so much, what you see in the ER where they come in and, they got their bell rung and they're dizzy and lightheaded and have a headache.
A few
Um,
weeks later.
This is 3 months later,
Oh, okay, gotcha.
a year later. These are the folks that, I had a lady, she was a teacher. She somebody had put a not a microwave, like a toaster oven on top of a vending machine in the school. And she went and got something out of the vending machine, and when she pulled it, the thing fell off and hit her in the head.
Wow,
Talk about the wrong place at the wrong time.
wow.
And she had, symptoms of low testosterone, low estrogen, low progesterone, low growth hormone, low thyroid. If you go down the list, she had them all. And when we measured them, they were low, right? And this had been 5 years earlier, and they put her on antidepressants and anti-anxiety agents, and we slowly brought her. Within 6 months, we started with real low doses, and we slowly brought her up, and she was 90% within 6 months of back to normal after 5 years.
You were giving her growth hormone or
Well, we
peptide?
used we used the peptides. I always start with the peptides.
Okay.
Okay. So ibutamorin MK677, 10 milligrams for women, 25 milligrams for men. Always dose it at bedtime for growth hormone.
Repeat that again, please.
Ibutamorin or MK677.
MK 677. Gotcha.
677. That's sort of the designation.
Hmm.
And 10 milligrams for women, 25 milligrams for men. Okay.
Okay.
Then there are the injectable. Well, there's a spray. Dr. Gordon, developed let's say, homeopathic spray that you'll get about a 15 to 20% increase in growth hormone levels. Um, and the spray is called Secretropin. It's made by University Compounding in San Diego.
Nasal spray. Yeah.
No, it's a mouth spray. It's like Banaka.
Oh, huh. Wow. Hmm.
Three sprays at bedtime. Have them hold it in their mouth for 10 seconds and then swallow it.
Do you have to like hold your tongue up or anything
No,
like that?
no,
Hmm.
no. You have them squirt it in the back of their throat. Just don't swallow it for about 10 seconds, and then
Okay.
okay. And then there's the peptides. So lately we've been using CJC 1295 with DAC, which stands for Drug Affinity Complex. And we like that one because it's the drug affinity complex. It makes it a six day half-life. So
Well, well.
so basically a once a week shot. It's a shot.
CJC, right?
1295.
1295. I have heard of that one.
Yeah. Okay. So Semarelin was the original. You may have heard of that.
Yeah.
It's been around since 1991. This is actually a synthetic, which we usually stay away from, but this is a lot more potent and less expensive. And we're not seeing any antibodies or anything like that.
Okay.
Okay. So we usually do a half cc a week on average. And the thing with the DAC is the patients will get a little bit of a hot flash about 5 minutes after the injection, and it'll last about 10 minutes. So you have to warn the men, especially. The women are used to hot flashes. The men are a bunch of babies. I got one guy who comes in every week, and he calls. He's out in the parking lot, and he'll call and say that we're making him burn up before he comes in for the shot. So,
Okay.
okay. Um, so basically that's it. This is growth hormone. Now you can measure. We do IGF-1 as a screen. You can measure growth hormone levels itself, but they're pretty volatile. You have to take them between 8 and 10 a.m. in the morning. Um, Ideally, they should have the technician, if they shake the cells, it'll break them, some of them, and it'll give you a false reading. And ideally, the lab should be run within a half hour of drawing the lab if you're doing growth hormone, which is never done. Um, so so you can also do an IGF-BP3. That's the one of the transport proteins for growth hormone.
Huh.
And so the complete thing that Dr. Gordon does growth hormone, IGF-1 and IGF-BP3. But quite frankly, it's kind of expensive, and the IGF-1 is the most stable, and it'll give you the most information. So 200 to 250 is our goal, and you'll see them at 60, 40, 80.
Huh. Okay.
Okay. And again, when we dose them, you don't want to try and hit them with everything at once because they you're gonna get sort of a rebound.
Okay. So I'm guessing that you'll intervene with sex hormones,
Yeah. Yeah,
pregnenolone.
I
Uh,
mean, it's everything here. I mean,
okay.
this is kind of, the last 2 weeks and this is kind of a summary of everything.
Gotcha.
And I think I've given you the whole, what to draw, you know,
Yes.
everything.
Gotcha.
Okay, this is just a kind of a schematic for executive function. And it's again memory, task initiation. So starting, finishing, projects, planning, prioritizing, thinking. Okay, keep that in mind. That this is really the hallmark of growth hormone, and this
Okay.
is how we put together head injuries and autism and hormone disruptions.
Uh-huh.
Okay, you'll see this, these disruptions in autistic kids also. And so the pathway for growth hormone, growth hormone is made in the anterior pituitary, and it has to stimulate the liver to convert to IGF-1 for growth hormone to be, if that's the functional part. In autistic kids, they have very high growth hormone levels for their age and very low IGF-1 levels. So there's a disconnect in the conversion in the liver.
Huh.
We attributed it to very high levels of interleukin 6, a
Hmm.
pro-inflammatory cytokine. So anything that will lower interleukin 6 should be effective. And it works to varying degrees. Nothing's perfect. But so what lowers interleukin 6? Curcumin, quercetin, nettle, fish oil. Those are our usual go-tos. Okay. Um, uh, there's a combination. You can get it on Amazon. It's about $35 a month. I forget, it's neuroimmune, I think it's called. I'll have to look it up again. Anyway, it's
Okay.
a combination of, it's got curcumin in it, and there's a couple of other anti-inflammatories. One called luteolin, and another one called um, rutin and leo. Okay, and it's a
I see.
yeah. And that's pretty good for lowering, in the anti-inflammatory cytokines, and it really helps with the kids' behavior. The sort of the outbursts and whatnot.
Interesting. Now, IL-6 is
Yeah, kind of
one
universal.
one of the end results of really bad inflammation, right?
Right, exactly. Yeah, it's one of the worst. So,
Yeah.
so I think I sent you at one time. Didn't I send you a spreadsheet with all hormones and remedies and what cytokines they're effective against?
Yeah.
I think you have
I,
that.
I did. It printed out really small.
Okay. Yeah,
Anyway, yeah, I got
yeah, okay. But yeah, I mean, just leave it on the screen, I guess. I don't know.
it. Okay. Yeah.
Okay. So on to the thyroid. Okay.
Yes.
As I've alluded to before, I can make a whole living just out of the thyroid because hardly anybody understands it, especially endocrinologists for some reason. So I always start when I give a talk on the thyroid, and I'm sure you've heard me say this before. All right, here's your white bread thyroid lecture. If the TSH is greater than 10, give them Synthroid. If the TSH is 4.5 to 10, if they have symptoms, give them the Synthroid. If it's less than 4.5, they're crazy, send them to a psychiatrist. Okay, lecture's over, right? Right? I mean, that's what they do,
Yes. Yes.
right? Thyroid antibodies, can't do anything about it. Diet, that doesn't matter, right?
Right. Yeah.
right? There's your stomach's bothering you, go see go see the GI guy, right?
Yes.
I mean, that's pretty much it. Okay, so what does the thyroid do? You should know this. Four,
Well, I mean, it's associated with energy and
four,
metabolism.
four words. You need the first two are it's your. Remember, you're talking to a truck driver.
It's your, I'm not sure.
Oh, I left it out of here. It's your gas pedal,
Oh, yeah. Okay. Gotcha.
right? So it's your energy source,
Yes.
right? You know, the mitochondria is the house of the cell. The thyroid's the powerhouse of the body.
Yes.
It affects every organ. Okay,
Yes.
and I'm sure you've seen severely hypothyroid patients, and you know they're quite train wrecks. In fact, well, let's go over this, and then let me tell you. I'll tell you about Lydia, who came in just yesterday. Um, so the thyroid produces two major hormones, the T3 and the T4,
Hmm.
right? It also produces a T1 and a T2. So remember, the T stands for tyrosine. That's the major. That's the sort of the backbone of the thyroid. It's the major
Yes.
protein. And the number one, two, three, and four, the number of iodines that are attached to the protein. One and two, we don't really know what to do with, so we just kind of ignore it. Although there's some rumblings about a T2 syndrome, and I'll get back to you on them if I think it's anything that we need to know about. Um, the three is the part that does the work. That's the thyroid. Getting the thyroid molecule getting to the tissues, and the four is the store unit. Um,
Okay.
remember, so remember my, you know, the analogies that I like. Um, the three. Do you remember Imelda Marcos?
Yes.
Remember the shoe lady, right? I think
Yes.
we talked about this, right? Remember the shoe lady? She had 3,000 pairs of shoes, right?
Yes.
So thyroxine T4 is the store unit. That's her closet. Okay.
Hmm.
The T3, and I think I had a picture of her, is the shoes that she's wearing right now. And that picture I had, if you remember, she had a purple outfit on with a scarf and green shoes,
Okay.
right? So the shoes that she's wearing at the moment, or you're wearing, or I'm wearing, are your T3. That's the part that's doing the work. Okay.
Okay.
All right. Now, remember, Synthroid, levothyroxine, is just T4, correct?
Yes.
So technically, think about it. What are they telling us to do? And that's the only treatment, by the way. You know, according to the endocrinologist, that's the only thing you can do. If you do anything else, you're a quack, right?
Right.
Right. So what is T4? So if you're filling up T4, well, I just told you T4 is the store unit, right?
Yes.
What are they telling us to do?
Yeah. Give T4.
Yeah, give T4. So what are we doing? We're filling up the closet until it
Mhm.
bursts, until it's right. And when there's no more room, then we get that conversion to T3, right? And that should work theoretically, which it does
Okay.
60 to 70% of the time. So if you consider that there are 20 million known thyroid patients in the US at any one given time, and probably 20 to 25 million that don't know they have thyroid issues, if it works like 70% of the time, 40 million, that leaves you with zero point 0.3 times 40. That leaves you with 12 million people that the Synthroid's not going to work for. Guess who
Okay.
shows up at our door?
Yeah. Those people that
Well,
is not working.
exactly. Right. And the endocrinologists tell them, no, you can't have lyothyroid. You can't have T3. You can't have the natural ones. It's gonna kill your heart. Right.
Yes.
And then when you give this, if you look at head-to-head studies of Synthroid or levothyroxine with the desiccated thyroids, universally greater than 50% of the patients feel better on the combinations, on the T3, T4, either separately or in a combination.
Gotcha.
Less than 15%. I think maybe it's 19% said they felt better on the T4 only, and the rest of it just it didn't matter, seemed to matter.
Desiccated has a mixture. Is that correct?
Yeah, the desiccated thyroids. There's only two left commercially. There's NP thyroid and Armor thyroid.
Okay.
Okay. And to convert it, 1 milligram of the desiccated thyroid is equivalent to 1.667 of levothyroxine. So 60 milligrams of NP thyroid or Armour thyroid is equivalent to 100 micrograms of levothyroxine. And you don't have to remember that so much. If you go on, just type in, I'm sure if you're seeing patients, you're sitting in front of a computer, type in convert Synthroid to NP thyroid or the other way around, and the little chart will come up and it'll tell you, what the equivalent dose is.
Okay.
Okay. The other thing we always forget about is that the thyroid produces calcitonin. It also has parathyroid glands in the back behind it, right?
Yes.
So it deals with calcium balance and bone density. So one of the major side effects, and I see it all the time, I see little videos on it and I see articles on it, is that long-term use of Synthroid, levothyroxine, creates osteoporosis. Well, duh.
Yes.
Right? You're supposed to be replacing the thyroid, not using, so it's not called Synthroid or synthetic thyroid for no reason,
Yeah.
right? If you don't address calcium balance, you're going to end up with osteoporosis. I mean, it's just
Hmm.
take a genius to figure this out. And let's think about this just for a minute, right? Where else have we seen this? Right? Where else have we seen this? We've seen this with estrogen, right?
Yes.
We're going to give you horse derived estrogen, and then we end up with breast cancer. Well, why is
Hmm.
that, right? Well, we don't want that stuff, so our body's going to build cells around it, right? I mean, it detects that there's estrogen in there, but it's going to build cells around the organs that it's affecting because we don't want that stuff, right? Use the
Yeah.
natural stuff, it doesn't happen, right?
Uh-huh.
Or it happens less than if we gave you nothing. Same thing with testosterone, right? The knee-jerk reaction. You get testosterone, your red blood cells go up, you're going to get blood clots. No, that's not it at all. Right. You have polycythemia vera. I'm sure you've heard that, right?
Yes. Uh-huh. Yeah.
So polycythemia just means increase in cells. Polycythemia vera, if you'll recall, is a rare blood disease which results in an increase in red cells, white cells, and platelets. With testosterone, it increases erythropoietin. With polycythemia vera, there's a decrease in erythropoietin. Um, Polycythemia vera is a genetic disease. 97% of patients have some sort of genetic abnormality. In testosterone, they don't. And they got a younger endocrinologist at the VA here now, so they stopped sending the old guy. Every time the patient's hematocrits went over 50, he sent them to the hematologist for them to go get bone marrows done.
I see. Sure.
I
Hmm.
kept telling him you don't need to do that, and go talk to the wall, right?
Yes.
Okay. All right. So here's the schematic actually. So here's your tyrosine. I always say this sort of looks like a stick figure without arms. So here's the body,
Yes.
legs, right? Okay. The number of iodines that are attached are here's 4, here's your T4, here's your T3. This is open. And remember this here. Remember, this is the reverse T3, the flip side.
Gotcha. Yes.
And we use this as cortisol, our stress hormone. This happens with a cortisol abnormality. 90 to 95% of reverse T3 is due to cortisol.
Yes.
And this is a pretty good proxy for cortisol. Instead of, so I use this as a screen rather than that saliva test that costs $250 that, no insurance will pay for.
Yes.
This is about $12, and and you can get it with the blood test, and this correlates very well. Okay,
Cool. Yes.
and okay, here are the symptoms of thyroid hypo and hyper.
Hmm.
I always call this a Goldilocks hormone. Not too much, not too little. Um,
Gotcha.
98% of the time, what you're going to see clinically is hypothyroidism. I mean, you may
Yes.
see it in the ER. You may see thyroid storms. I'm sure you have, right?
Yeah. Occasionally.
Yeah, yeah, not too often. Uh,
Yes.
but the folks that we see are rarely hyperthyroid. Okay. So hypothyroid. So we concentrate on the hypothyroid. Hypothyroidism, dry skin, dry hair, fingernails crack and break, constipation, can't lose weight, cold all the time, tired all day long. And the eyebrows thin out on the edges. Okay.
Yes.
Remember the eyebrows. So the inner third of the eyebrows are the sex hormones. So testosterone for men, estrogen for women. The middle third is growth hormone, and the outer third is the thyroid. So if you look at eyebrows and keeping that in mind, after a while you'll start to see patterns.
Okay.
It's not readily noted, at a casual glance. But if you spend a little, every person you come in, look at their eyebrows, and after a while, it takes a little while, but you'll start seeing patterns,
Okay.
right? And somebody comes in and they're exhausted all the time, and they're gaining weight, and they're getting fat, and they're getting, every morning they wake up and, oh, by the way, hypothyroidism, early morning puffiness or swelling of the face in the face, also
Okay.
another symptom. Okay. Um, and you look at their eyebrows, and the outer third of the eyebrow is is missing,
Then,
right?
uh-huh.
And you can tell them, well, I mean, even if you don't tell them, you says that, here's your working, hypothesis right here. Okay. By the way, the first symptom of hypothyroidism, and it's usually a retrospective thing because we don't recognize it as such because the lab values are normal. But the first symptom is an unexplained onset of anxiety.
Uh-huh. Okay.
It usually we traced it 5 years prior to any of the other thyroid symptoms or the labs becoming abnormal. But so someone who comes in and who's anxious and has a family history of thyroid issues, there's not much you can do about it as far as if they have low thyroid and whatnot. But you can, we can measure their nutrients. We look at lately we've added urinary spot iodine to our lab
Huh.
panel.
Uh-huh. Yeah.
I think I've told you that. Um, okay, so we're doing urinary spot iodines now. 24-hour iodine urine collection would be better, but that's kind of tough. It's
Yeah, sure.
tell somebody to walk around with a bucket, every time they pee, for
Yeah.
4 hours.
Not the easiest. Yes.
Business people don't really want to do that, Just
Yes.
do it on the weekend, I suppose. So, okay, so hyperthyroidism is the exact opposite. It's hair loss, bulging eyes, sweating. Sometimes they get goiters, but it's a rapid heart rate, a heat intolerance, tremors, inability to sleep, diarrhea, weight loss, soft, moist palms, and soft fingernails. So cracked fingernails is hypo, soft fingernails is hyper, cold is hypo, hot is hyper. Um, Weight gain, constipation is hypo. Weight loss, diarrhea is hyper. Okay, so just they're sort of the polar opposites of each other.
Gotcha. Okay.
Okay. Okay. So why does it go on the fritz? According to the endocrinologist, it's a failure to convert T4 to T3, and that's it. The inadequate nutrients, that's sort of just their acknowledgement that there's a whole cadre of patients that don't respond to Synthroid. Um, so they've said, well, maybe it's some nutrients. All right. We look at all of these issues. Okay. So we're going to look at the immune system. So you're going to draw a TPO and antithyroglobulin. Um,
Yes.
I automatically now. I mean, if we do a GI stool test, you'll get a gliadin. The protein.
Okay. Yeah, that makes sense.
They'll be in there. But even if it's positive, even if it's negative, these folks are extremely sensitive to gluten. So gluten-free diet, and I tell them, this is a Judge Judy deal. It's a yes or a no. Either you're doing it or you're not. Okay.
Hmm.
Not a little bit, not 90%. And I mean, I'm guilty of it too at times, but and I don't have thyroid issues, but I know when I eat just that stuff, I feel terrible. So toxin exposures. So Originally we sort of restricted it to heavy metals, so aluminum, cadmium, mercury, aluminum, cadmium, mercury, arsenic, and I always forget one. Uh, there's another one. Aluminum, mercury, cadmium. Oh, lead. Okay.
Lead. Okay. And what test do you do for heavy metals?
We've been doing doctor's data now. So we've been doing in that one, you can get an environmental. So we're getting an environmental toxins too. So I had a guy came in who was in he owns a pest control company.
Oh, yeah. Hmm.
25 years he's been spraying chemicals.
Oh, goodness
And guess
sakes.
what? He's got hypothyroidism. He's got autoimmune hypothyroidism. That's
You
not a big
bet.
surprise. Okay.
I'm
Um,
surprised he doesn't have cancers.
huh?
I'm surprised he doesn't have cancers.
Uh, Not that we found yet, but
Okay, good.
his 3T3 was like 1.9.
Wow.
Yeah. So his TSH was like 11 and his TPO was about 1,000. So yeah.
Wow.
Infectious diseases. So the one you want to find is H. pylori. So that one we've actually gone back and treated H. pylori, and we've done it the medical when they let us do the medical doctor way. They don't always, but so the triple therapy
Uh-huh.
or the four, the two antibiotics and the PPI or the Pepto-Bismol, whatever they call that.
Yes.
You know, um, about 1 to 2 patients a year, if they have H. pylori and we go back and retreat them, the thyroid disease goes away. And
Okay.
it's my experience. Okay, I don't know if it's in a book anywhere, anybody wrote about it, but that's been I've been doing this for 20 years, and that's about right. And it's only men. Only men have been cured for some reason. For some reason, it's only men, and it's only H. pylori, and it's just a few, very, very few. But if somebody comes in and they have thyroid issues and H. pylori, I get a little bit excited. I don't say anything to them because you don't want to promise anything, but those are the ones that sometimes we can cure. Um,
Okay. Cool.
okay. Um, Hepatitis, herpes, Lyme disease, and Yersinia, which is food poisoning. So I had a kid who he came in this was a few years ago in March. He had gone to Cancun for Christmas break. He got food poisoning. He shows up in March and his thyroid is in the gutter, and his TPO was like 500, and he'd never had any, and he had all the symptoms.
Yeah.
And also his testosterone dropped too. His testosterone was like 200. He was 26 years old. So I think I've showed you the note he went to an endocrinologist after we fixed him up, and that was the guy who said, "Well, he's got Hashimoto's, but he doesn't need any of that stuff, and testosterone is low, and and you don't give young kids testosterone, but I'm going to send them to a urologist to give them testosterone pellets." So
Yeah.
I showed you that, didn't I? Didn't I have that
Yeah.
somewhere?
Yeah, you did.
Okay,
Great.
HPA axis insufficiency, that's your cortisol disruption. Uh,
Okay. Yeah.
Okay. Iodine. So like I said, we're doing spot iodines now, and we're finding a lot of iodine deficiencies.
Uh-huh.
All right. You remember iodine and selenium are the two chemicals, the two nutrients that you need to convert T4 to T3.
Yes.
And as genius doctors, we did it.
Yeah.
Um, in 1947, that report came out from those two geniuses in Berkeley. Wolf and Chaikoff were their names. That they injected rats with radioactive iodine, and when it killed their thyroids, they decided that food grade iodine did the same thing. And somehow they convinced the powers that be that iodine was a poison. So so the whatever the FDA was there, removed iodine from the 60 largest U.S. cities food supply. They took iodine out of the food supply. At the same time, at the same time, there was a big push to put fluoride in the water because it protected against tooth decay,
Right.
right? Well, if you remember your periodic table, right? Iodine and fluoride are what?
The same outer
Yeah,
valence.
they're halides. They're similar.
Yes.
So when fluoride started showing up in bloodstreams, our bodies decided that it was iodine until it realized it wasn't. So it took 5 years. So in 1952, 1953, all of a sudden we started getting reports of severe and multiple hypothyroid issues and autoimmune hypothyroid issues.
Okay.
Okay. So, politicians, of course, are never wrong, right?
Right.
But they realized they made a mistake. So they had to fix it somehow. So they decided that they looked at what Americans eat too much of, sugar and salt, and they just picked salt. And so they put iodine and salt. So that's where iodinized salt came from.
Wow.
It could have been iodinized sugar. They just picked salt. Okay.
Yes.
And partially fixed the problem. But low iodine had two other pretty profound effects. So if you look between 1952 and 1955, all of a sudden there was a breast cancer, breast mastitis, fibrocystic breast disease epidemic, which it
Huh.
hadn't heard of before. Guess why? Breast
Well,
tissue breast tissue needs iodine to be
interesting.
quiescent. Yes.
Fascinating.
Yeah. So we have done with when we know it's benign breast cysts and breast lumps. We've actually had patients get Lugol solution and actually just sort of paint it on the breast tissue.
Oh, okay.
And we use that. And then we use at bedtime, we have them use progesterone cream and just the over the counter, like the 2% or 5.
Yellow.
And you'll see that most of the benign breast lumps will dissipate. Also, like breast, fibrocystic breast issues will
Huh.
dissipate within about 6 to 10 weeks.
With painting topical
Topical
iodine.
topical iodine and topical progesterone.
Interesting.
Yeah.
Okay.
Okay. That's one of my little clinical pearls.
Cool.
Okay. And then there's certain medications. Amiodarone, I think I've talked about that one.
Yes.
That's a biggie. Beta blockers, synthetic progesterone. I think I told you about Angela, my nurse's daughter. You remember, did I tell you about Angela?
Can't recall which
Ring a
story.
bell. She was 18 years old. She was adopted from
Oh, yeah.
right, and then, she'd been getting birth control pills.
Birth control. Yes.
Remember, mom was a hardcore Bible banging, practicing Catholic.
Yes.
So birth control was taboo. And remember, I think I told you, right? She came to me 2 years of severe hypothyroidism, and no one could figure out where it was coming from, and it wasn't getting any better. And she showed up one day. It was Good Friday. And she said that Planned Parenthood was closed, and would I write her a prescription for her birth control pills because she was out, and nobody knew she was on it.
That's right.
Yeah, you remember that one, huh?
Fascinating.
That was Angela. That was
Yes.
1988. So how long ago was that? 12 and 20, 36 years ago. So she'd be 18 and 30, 44. She'd be, no. Yeah. She was 18 at the time. So she was born in 1970. Yeah. So she'd be 50 something by now. Okay.
Uh-huh. Interesting.
Yeah. So that was Angela. So Emma, birth control pills, and then this was one thing that really got my if I was Irish, got my Irish up. So, and Fentanyl is also another medication.
Ah, uh-huh.
I did this presentation for AMMG a couple maybe 2 years ago, and I didn't put Fentanyl in. I put Dilantin in. So Dilantin
Yes.
is the trade name. I mean, it's
Yes.
only been around for 1,000 years, right?
Right.
They had a they had a conniption over the fact that I didn't put they sent it back and said I have to change this and this is unacceptable because I put in the trade name Dilantin,
Goodness.
right? So at one of the lectures, and I can even send you the slides. The guy was talking about mitochondrial dysfunction, and one his remedies were something called that he mentioned was Tri 40, which was liposomal glutathione, and something called ATP 360. Well, he was sponsored by Research Nutritionals, which is a supplement company, and that's their
Yes.
brand names. And he had that in the slides, and he mentioned it on stage in front of 5,000 practitioners and said, "Come to our booth at Research." I mean, that is a no, no, no,
Yes.
right?
Wow.
But A4M is so big that they probably just they don't care. Us they squash like bugs.
Yes.
So I even sent in my critique, I even sent that.
Okay, good.
Oh, remind me, I didn't do my CME credits for them. So remind me to do that. Okay, here's your labs for thyroid, and what I don't have in here that's new is a spot urine iodine.
Okay, gotcha.
So add that. In fact, let me see where I'm going to add it right now, if you don't mind. Oh no, that's a picture. I can't do that. Okay, never mind. I'll do it later. Okay, make sure you add the spot urine iodine. Okay,
Okay, got it.
all right. Okay, reverse T3. Excess or deficiency it doesn't really tell you if it's high or low cortisol, but the first two steps in fixing cortisol doesn't really matter because what we use are adaptogenic herbs. So we use the same thing whether it's high or low.
Yes.
Okay. We use adaptogenic herbs without adrenal uh, cortex. First line, second line is with adrenal cortex. After that, then you need to do the saliva test, and that's the way I do it anyway. Okay.
Okay.
I mean, if you go to IFM, they send you to the saliva test right away. And I did do that originally, but again, it's expensive. Nobody pays for it. And, we're spending a lot of money anyway on tests
Yes.
and whatnot. So if we can cut down on one and save us, and quite frankly, I mean, I used to do that saliva test on almost every patient. And now if I do 10 a year, that's a lot.
Okay,
We can spend the money elsewhere.
gotcha.
Here's some of the other reasons. So starvation so this is basically intermittent fasting, diabetes, long-term beta blocker use, um, and chronic inflammation. Okay. So,
Okay.
but I mean, if you have a high reverse T3, that's a cortisol issue. Um, okay. Thyroid antibodies. TPO, you have to do them both. Sometimes one will be positive and one won't. Usually the TPO is the one that'll be positive and the antithyroglobulin will not be. Um,
Okay.
but rarely you're going to get it the other way around. And if you don't do them both, you might miss it. If you get one or two they're negative, you probably don't need, and they have thyroid issues, you probably don't have to redo it. Or if they're with you for a long time, I got people that with me here. I've been here 11 years now, so I've been people with me since the beginning. Um,
Yes.
so I'll repeat it maybe every 3 or 4 years just to see if there's any change there. But for the
Sure.
most part, you don't need to do that. Um, so so the normal for thyroid for TPO, the antithyroid peroxidase antibody for LabCorp, it's 34. For the Quest scale, it's 9.
Okay, gotcha.
Okay. And then the big hospital in town here, because a lot of patients go there and get their labs, they use the Quest scale, which is 9. All right.
Okay.
So optimal would be about 20 on the LabCorp scale and about 6 on the Quest scale.
Okay.
Okay. Antithyroglobulin, um, again, the labs will differ. And it actually, I've seen it change it from 5 to 4 as normal. Or you'll have ones is less than 1.0. Sometimes it'll say 0.9. So what you need to do is you need to you got to look at your reference ranges there because you got to see which scale it is.
Okay, got it.
Graves' disease, I only draw this if they have hyperthyroid symptoms. So
Uh-huh.
the TSI, and less than 130 is considered normal. We want it under 80.
Gotcha. Okay.
Okay. And again, I mean, if you see one a year of these, at least in what we do, that's a lot.
Okay.
So we had one of the so the madam, I've told you that I see the girls at the Mustang Ranch, right? The ma- the
They
madam's
see you? They come to you as patients?
yeah. When I first started, I used to go out there once a week. Yeah. So I don't go there anymore, but the madam sends them to me. We do cosmetic stuff and stuff like that.
Uh-huh.
Um, they want we do IV therapies and we get whatnot, and if any of them are sick, she sends them over to me. So she sends this lady, um, and and these girls, most of them are drugged out, and they look like they're 30 years old and they look like they're 60. They're beat to
Mhm.
hell, right? So this one girl, she shows up and I don't feel good. And, I'm, and she's got, everything's kind of vague. She's on Synthroid, levothyroxine, 137 micrograms. Um, well, yeah, and so, and they lie, so I get her labs back. Her TSH is 145. The
Huh.
free T4 was zero point 0.3. The free
Huh.
T4 was 1.4. I don't know how she was walking around, and
Wow.
and it took us. She kept dodging us too. I finally tracked her down with the madam, and they actually brought her to the office yesterday.
Oh, really?
Pretty much kidnapped her. I said, I don't know how this girl's alive, and it's my job to at least let her know that she's got a big problem here. The T
Yes.
the TPO was 142. The antithyroglobulin, all they got for me was greater than 1,000.
Oh, Jesus.
Yeah. So, right, with a TSH of 140. You ever seen that? 145?
No.
Yeah. So of course she had stopped her levothyroxine 3 months before because she decided she didn't need it. Um, I said, I don't know how you're getting out of bed. She goes, well, she goes, I sleep in between shifts. And she says, and she tells me, she says, I dance 6 to 8 hours a night. And so
Wow.
you know what kind of dancing she's doing, right?
Sure. Uh-huh.
Right. I said, well, and then I said, look, you got a big problem here. I'm not judging you on anything, but I got to know. So, I mean, do you use drugs? No. Do you drink? No. I mean, come on. Yeah. I mean, she's got her lips were all puffed out. Someone had put filler in there. I mean, and she looked like, death warmed over. So the big problem is now, so where do we start? Okay, because she was on
Yeah.
137 micrograms, but you can't start there. You're gonna have it's going to make it worse actually. At first, you're going to have like a rebound, like nobody's business. Um, so I started at 75, and I think even that's probably too high. And every 3 to 4 weeks, we're going to increase it. Um, I would have rather gone with the natural ones, but I have a feeling she's going to end up in a hospital somewhere. And of course, that when we do things like that are outside of the realm of medicine, it's going to be our fault that she's this way,
Yes.
right?
Okay.
All right. So I started her on 75, and I told her she was leaving for to go home for Christmas. Also, she lives in North Carolina, so she's going to be gone for a month.
Yes.
So I
Got it.
said, well, you got to stay in touch because we're going to have to keep increasing your medication until we get it right, but you can't do it overnight. Um, so I suspect what she'll probably do is end up taking 2 or 3 of them, and
I see.
yeah,
Sure.
This is not the type of person that's going to say, okay, and she said to me, she says, yeah, I've been neglecting myself and I've just been going on and I drink coffee all day long. And I said, using any drugs? No, no, no. And he says, well, any Red Bull or, she's using some sort of speed, to keep her going.
Yes.
And, they get all sorts of drugs in that place. So, um, now the madam's pretty good. I mean, if the girls are nice girls, and the madam
Yeah.
doesn't send the bad ones to me because I'm too nice. But
How many are out there?
there's probably anywhere from 12 to 20 at any one time.
Interesting.
Yeah. Yeah, it's an interesting place. When I went, I used to go out there on Wednesdays and one Wednesday they have tours. There's a restaurant there. You can go just to eat and tours. But one Wednesday I was there and the Red Hat ladies came in. You know who the Red Hat ladies are?
Yeah.
Yeah. I mean, that was the funniest thing you ever saw.
They went there. Oh, to
They went
tour?
there for lunch and a tour.
Oh my gosh.
And so they um and so it was the fall or in the anyway it gets cold and they keep it cold in there. It was cold in there and it's dark except the doctor's office isn't, but it's dark when and especially and it's way out in the desert there, and there's bright sunshine. It's even in the middle of winter. The sun is out here every day. And
Yes.
you go from outside to inside, and your eyes have to adjust. And right inside that, well, on let me say, when you came in on the left hand side, they always had a fire going. So if I
Yes.
was seeing anybody, I would go sit in front of the fire just to warm up. So I'd always be sitting there, right? And the Red Hat ladies come in, and right as you come in, there's a display case with toys.
Oh, like sex toys?
Yeah, yeah. So
Okay.
one of the ladies says to me, she says, "What are these things?"
Oh my gosh.
I said, "You know what? When they give you the tour, ask the tour guide. They'll tell you what it is." Yeah, I took my father out there too. One during the shutdown, he kept telling me I had to take him out someplace new all the time. And then one day, and on Saturday and Sunday, I had to take him out for longer rides. I took him to Pyramid Lake one day, and there wasn't anything there, and it was an Indian colony. And so one day he said, "Take
Interesting.
me I couldn't think of any place to take him. I taken him to
Now,
Lake Tahoe, and right, so I took him to the Mustang Ranch.
so so aren't they required to get STD testing?
Yeah,
Is that what you do
yeah, that's what I did. Yeah, once every week,
every week?
every week. And they want to stay clean because they want to work.
Sure.
I mean,
Do you have an idea
you're
of
much
what the?
safer there than you are in pretty much any place
Oh,
else.
sure, sure. And how far is it from Las Vegas?
Oh, it's 400 miles.
Oh, it is. It's really all by itself.
Well, it's in Story County here. It's like 15 minute ride from my office. We're in Reno.
Really?
We're the
I
second
had no idea.
city
I thought it was outside of Las Vegas.
Well, there
Oh
are
my.
ones there.
Oh, I see.
Yeah, they have them there too. But
Do
but
you have an idea of what the split between the
yeah, it's
house
50-50.
50-50?
Well, it's between the house and the girls. I don't know what the town takes, but they do.
Oh gosh.
Right.
And what is the average for like an event? Is it?
Well, and I haven't been out there in a while, so I don't know. But when I was out there, it started at 500 for an hour.
I see. Okay.
And so what you do is when you go there, they have a negotiation room.
Yeah.
You
Okay.
go there first, and then you negotiate what you want, and then they come to a price, and then you go out to the clerk, the money taker who takes it and gives you a ticket, and that's what you get.
I'll
So
be done.
at 10 a.m. and 3 p.m. they have the lineup. So if you're a newbie and you don't know, you don't have a favorite, you can go and they'll give you a drink, and you sit and it's in the lobby, and all the girls line up, and then the guys, or it could be girls too, but they pick who you want. And
Fascinating.
for more money, if you want two of them or three of them, you can have that too.
Okay.
It's pretty much
Yep.
anything goes. But one day there was a well, it was me actually. Um, I had borrowed my secretary's car because mine was in the shop. And I went in, and as I was going in, the owner was coming out, who's my patient, by the way. And
Uh-huh.
they know every car, you have to register your car when you go there. Um, and I didn't have her, and didn't have the car registered. I wasn't there 5 minutes. There was like this alert. You never saw so many guns come out like in a split second. And it's because he had called in that there was an intruder.
Oh my God. Did they pull guns on you?
Well, they called guns on everybody until they realized that it was me that he was talking
Oh
about.
shit. And you were using somebody else's car.
Yeah.
Oh,
Yeah.
hell.
Yeah. So, and they have cleaning people there. Everybody there was nice to me. I mean, and I had a whole new, like I said, the madam didn't let me see the bad ones, and I've seen them, medically separate, and some of them are train wrecks, but
Yeah.
every one of I to a fault, every one of them, at least to me. I mean, I was just business, so
Sure,
every
sure, sure.
every one of them was respectful. Every one of them was couldn't be nicer. I,
Uh-huh.
I mean, I got a whole different perspective on it. And some of them go on. One of them went to nursing school and is like one nursing one of the head nurses in the operating room at the big hospital here now.
Wow.
Another one, and she owns an auto parts business now. She got out of that business, and she owns like 4 auto parts stores. So some of them use it for. And I got hit by one of them in a fender bender a couple of years ago. I was stopped at a red light and I got hit from behind, and it was one of the girls, and she's
Oh,
22 years old, a 750 BMW. Um,
really? Huh.
I did a little snooping afterwards and found out she owns her own home without a mortgage. She owns $100,000 car. This is too hard to me.
Well,
I had to go
there's
to medical school.
yeah, there are quite a few RNs that have a history
Yeah, yeah.
of at
So
least dancing,
yeah, yeah. And some of them made movies.
Hmm.
They want me to watch their movies for 5 seconds. I said, what? I don't want to see you this way. I see them in the office. I mean, some of them come in their costumes and whatnot, but it's like after 10 minutes, if you've been there a couple while, you don't even notice.
Okay,
So,
if you say so.
it's a, it's a business.
Uh-huh.
Basically it's a business. That's what they're selling. So they have to look good.
Yes.
They have to keep themselves clean, or because their product is their body. So,
Yes.
like I said, I haven't come across one that wasn't sweet as could be, kind. They when they start out they look good. By the time they're 30, they look like hell. But like,
Yes.
okay, the other things for thyroid you want to draw are B12, ferritin, and B12 folic acid. I don't have folic acid on here. B12 ferritin, and we always do a vitamin D.
Gotcha.
Okay?
Hmm.
And you want those, the ferritin and the B12. You want and folic acid in the upper third of normal. So for
Gotcha.
B12, you want it over 700-800. For folic acid, you want it over 4.0. Ferritin about 90 to 110 is good. And for vitamin D, 50 to 80.
Okay. What do
Okay.
you do to get ferritin higher?
Iron.
Oh, okay. Gotcha. Gotcha.
We use iron glycinate now. We don't use iron ferrous sulfate.
Okay.
Iron glycinate is 28 milligrams, but the glycinate doesn't bother their stomach.
Okay. Gotcha.
Okay. Um, okay. So this is kind of just a schematic of the whole deal. Okay.
Okay.
I compared, conventional, model to what we do. And there's quite a few specialty tests that we'll go over when we go over some of these other modules. So we do a functional GI test, stool, the microbiome, and you can use Genova's GI effects, or Diagnostic Solutions has one called a GI map. Um, there's a whole bunch of them. They do, and we'll go over that. That's kind of what I've been putting together now. There's a SIBO test, which is small intestinal bacterial overgrowth. That deals with small intestinal infections. Micronutrient testing. There's a bunch of ways to do it. I like the SpectraCell one because basically it's a direct read. If they have low B12, it'll tell you low B12. A lot of the we'll do something called organic acid test. It's called the oat test. It also is micronutrients, but I have to spend 2 hours interpreting it,
Yes.
which I don't really want to do.
Okay. And that oat test is from who?
Genova is the one,
Genova. Okay.
but they use kinuretic acid. I know that's B12 and folic acid, but I mean, there's a whole slew of them you got to go through. With names that are not household names, and I don't want to spend 2 hours doing it, for each one.
Yeah, right. Got it.
The SpectraCell, gives it to you directly.
Okay.
It'll say glutathione, it'll say B12, it'll say B6. I mean,
Okay.
the heavy metal testing. I told you what to look for there.
Oh, I used to do the NutriVal. Is that kind of
Yeah, that's another one. Yeah, and again, that's again, you have to interpret that. So
yeah.
so so what a lot of those are just combinations. So Genova over time has taken a lot of those tests and combined them. Okay, so I think NutriVal is in that organic oat test, which is
Okay.
in the big GI effects test.
Oh, so the GI effects is actually larger, has
Yeah.
more tests in it than the
Right.
NutriVal.
Yeah.
Okay.
Viral cultures, bacterial cultures. We do C-reactive protein and, of course, the hormones. Okay.
Okay. Gotcha.
Right. And then our therapies, we will use levothyroxine. Sometimes we'll just use liothianine. We do like the combinations. Plant sterolins, that's your for the thyroid antibodies, that's your Moducare and Wobazyme N. Moducare is more effective, but it's more expensive. Use that twice a day. And then, of course, low dose naltrexone. We did that, right?
Yes.
Okay. And then the diet, of course, the endocrinologist, it doesn't matter, right?
Yeah. Yeah. Yeah.
Right. But a lot of patients will tell you they can't eat gluten, or even if they don't know what gluten is, they'll tell you when I eat, if I go out and have pizza and a beer, I'm sick for a week.
Yeah. 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 Yeah.
So gluten is important. White flour, white sugar, dairy, those are the bad guys.
Gotcha.
We have an online program that we use that I buy. I think I've told you it.
Mm-hmm.
It's a body site. It costs $199 a month, and I mean it really saves you a lot of time. And it sends out. All you have to do is put in the patient's name and email address, and there must be 150 different types of diets, and you can even write your own. And it'll send them recipes, menus, add a boys, add a girls,
Huh.
exercise tips and tricks, anywhere from 30 to 90 days.
So your cost is 99 a month.
199 a month. And you
190.
can charge, I mean, there is a way to charge patients for it. I don't,
Sure.
but it's in there. I mean, it's actually built in. It's a patient
Gotcha.
charge, and it'll send them a receipt, and they won't turn it on until they pay it. So uh,
Okay. Gotcha.
I don't, but you can.
Okay.
So basically, here's your function of your thyroid. This is sort of the metabolism. It's your gas pedal, smooth organ function, energy, mental clarity, and again, deficiencies, no, sorry, dry skin, dry hair, fingernails crack and break, constipation, can't lose weight, cold all the time, tired all day long. If you look in some of the functional medicine books, they'll have 400 different symptoms that they can somehow attach to the thyroid abnormalities,
Oh, okay.
but those are the main ones.
Gotcha.
Okay. Um, Anxiety and depression are two of the again first symptoms that'll show up 5 years before the thyroid numbers become abnormal.
Gotcha.
And the other thing that I always emphasize with any type of thyroid issue is they're going to have GI abnormalities. They're going to have food intolerances. They're going to have digestive dysfunction or dysbiosis. Okay. So you
Gotcha.
always want to look at the GI system. Somebody comes in with GI symptoms, you want to look at the thyroid. Somebody comes in with thyroid issues, you want to look at the GI system.
Sure.
They're
Gotcha.
interrelated and not, I went to the gastroenterologist, he did a colonoscopy and I had two polyps. That's
Yeah.
not
No.
that's not not it. Okay.
No. It really is amazing at how they've just turned a blind eye to digestion. It really is.
Yeah, and when we go over to microbiome, when I finish it, you're going to see that microbiome, that's where the rubber meets the road.
Yes. Hmm.
Okay. So again, here's your root causes of autoimmune disease:
Hmm. Gotcha.
cortisol, and it's quarter to eight. Um,
Got to go.
let's see if we can do cortisol fairly quickly. Okay.
Okay.
So cortisol, that's your fight or flight, right? That's your
Uh-huh.
first protector. And there's something called the pregnenolone steal syndrome.
Yes.
Pregnenolone is the second, after cholesterol is conjugated to pregnenolone. Pregnenolone then turns into all of the other sex hormones and cortisol. But if there's a stress, acute stress, the pregnenolone is going to direct all of its resources to cortisol at the expense of all of the other hormones. Now, acutely, it doesn't really make a difference. It's usually just a couple of an hour to a couple of hours. But if it's a chronic thing, eventually you're going to end up with the sex hormone abnormalities, and thyroid is actually indirectly related here because you don't have enough substrate. The cortisol is the hormone of stress, and
Yes.
it becomes it gets acutely high in acute stressful situations. So traditionally, back in the day, if you went out hunting and would go around a rock and there's a dinosaur there or a mountain lion, the cortisol levels go high, and then whoever wins the fight, let's say it's us. Um, the cortisol levels should go down to that low level, just sort of under the radar until it's needed again. But of course, the way we live is not like that, right? I mean, you're working in
Yes.
the you're on high alert all the time, and then you get three of them in a row, or a car accident with four of them coming in, and they're all half dead.
Yeah. Bad deal.
The cortisol levels never go down, right?
Yes.
And again, excesses and deficiencies are pretty much the polar opposites of each other. Um, you end up with blood sugar abnormalities, joint abnormalities, blood pressure issues, either low or high. The big controversy, in the real doctor world versus what we do is so the symptoms that we'll see are the patients wake up in the morning, they're tired. In the middle of the morning, they need something to keep them going, coffee or tea or Red Bull. In the afternoon, they need a nap. By dinner time, they're exhausted. Later at night, 8, 9, 10 o'clock, they get a second wind, and then they need and then they have trouble sleeping, and there's usually sugar or salt cravings. Um,
Okay.
those are kind of the core symptoms, either high or low. Um, and remember, the issue is that there's either Addison's disease, which is low cortisol, or
Yeah.
Cushing's disease, which is high cortisol, and there's nothing in between. And what we're looking for is what's in between. It's not Frank Addison's, it's not Frank Cushing's, but they have all these symptoms. And just to say,
Right.
well, come back when you're down to nothing, is ridiculous.
Gotcha.
Okay. Okay, you know what? I have to go to down to South Reno today, and I have to get ready. I
Okay.
have to leave by 8:15, and so I have to get ready. So why don't we
Okay.
stop here?
Okay.
Um, questions?
No, I'm good. Thank you.
Okay, and I will send this to you when it's ready.
Okay.
And I think we did pretty well here. Um,
Yes.
any questions, comments, anything you need, let me know. Um,
Okay.
Are you how you doing on your quest for a practice? Is that
Uh,
going to
I,
happen?
Developing, yeah. My friend is opening his practice in the next couple of months, and I plan on working with him. So yeah.
Okay. All right. Well, if you need any help, let me know.
Okay. Thank you very much. Yes, I will call on you. I absolutely.